Ravani, can you spotlight Dr. Kritika?
Yeah.
Dr. Kritika, can you please turn spotlight for everyone?
Okay, from where do we do that?
You just have to turn your video on. We'll spotlight you.
Have you here with us? Lavanya will be sharing the PPT. There are
Yeah.
few people
Is
who are
the screen
joining us.
visible?
Yes, Lavanya, just put it on the slideshow mode.
Dr. Kritika, are you able to view the screen?
Yeah. Yes, I can view it. So, good morning, everyone. This is Dr. Kritika here. I'll be speaking about arthritis today. Any questions? Should I be in English is okay, right? The session?
We can mix Hindi and English both if you're comfortable.
Yeah, okay. So, at the end, any questions are there, then we are happy to solve them for you. Otherwise, we'll go ahead with the general guidelines for now. Okay. So, what is arthritis? Basically, we'll start with that. Arthritis is a broad term which is used for all the conditions that are affecting the joints, basically the weight-bearing joints, or the joints, the junction where the joints meet. Multiple reasons lead to pain, swelling, stiffness while movement or even at rest. And depending on the cause, it varies person to person. There are a lot of types of arthritis, and we'll be mentioning only the common ones today. It is seen in adults as well as in children. And while understanding arthritis, why it is necessary to empower with the health education or awareness about arthritis is so that you know when you should be meeting a healthcare professional, what things are there that you can do at home, and what are the risk factors. So if there are some particular things by which we can change or we can reduce the risk for you, then how we can do that and what precautions need to be taken. Next one. Okay, so the types of arthritis that we are covering is osteoarthritis because it is the most common one. So osteoarthritis normally it arises because of aging, or it is a degenerative process which is happening at the joints because of increased wear and tear. So very common in old age people, mostly above 60 years old. Nowadays also seen in younger population because of the increased usage of these weight bearing joints. Rheumatoid arthritis. This is an autoimmune disorder in which the arthritis or the joints are attacked by the immune system of the person itself. Gout, again, very common because of the health awareness. People nowadays are consuming a lot of protein, irrespective of not knowing how much quantity is required by the day. So there are particular lifestyle habits which lead to gout earlier in life. So this is because of those uric acid crystals getting deposited in the joints. Psoriatic arthritis, it is related to the inflammation of the joints because of psoriasis. Ankylosing spondylitis is basically it affects the spine, common in older age. Again, it is discomfort and stiffness of the spine that happens. Next. So we can also discuss the type of arthritis. So if anybody has some questions, can drop it down regarding their concerns or osteoarthritis or any particular things. When you see the types of arthritis or the symptoms of arthritis in people, okay, so the symptoms vary depending on the type of arthritis. When it is old age or degenerative related, it starts with when you have overused the joints, and slowly that increases as even at rest. Okay, so it begins that when you are walking a lot, or you have done the stairs, or you have done a lot of walking, the knees or the ankles or the weight bearing joints, they start paining. That is the initial stage, that is in osteoarthritis. Later it becomes continuous at rest also. Then other symptoms can be swelling, redness, warmth. These are normally inflammatory type. So any type, like most common is gout or any inflammation causing arthritis, because of which those products increase into the joints. There is a swelling of the joints causing. So until we do not solve the problem, that issue will still remain. The heat is there, the swelling is there, so you need to go to a healthcare provider. Okay, stiffness is particular with, I would say, the inflammatory type only, and it is more in the morning. So very common in the morning times, and as the day progresses, it will improve. Next one. Okay, so test. When we are going in for the test, it is preferred that I would say that you go to a GP or to a orthopedic or a physiotherapist, where they will check first. Physical examination is very important. So 1-2 days is fine. Suppose you have overused the joint, or you have got some injury or something, max to max 24 to 48 hours, where it should settle by itself. It is, if it is not settling in that much time, then you should know that you need to go to a healthcare provider, where the doctor will examine and then tell you what needs to be done. Okay, on the base, there are a lot of tests on examination where they can understand what type of arthritis it is, and then we go move on to the other modalities, where it is blood test or x-rays or MRI, depending on what are the other options or differential diagnosis that can come around. So when we are looking at the bones, we go in for x-rays. When there is a soft tissue involvement, maybe there is inflammation of the muscles or tendons or something, we first go in for an ultrasound. If it is something major which we are expecting a lot of, we don't want to know the degree of the nerve involvement, bone involvement, all of this, then we go in for an MRI. Okay, so there are grades by which we go gradually. We don't directly go in for an MRI for everyone. Blood test, not specific, but then it does give us better, I would say, confirmed diagnosis. So a lot of things together, we correlate and then understand that what type of arthritis it can be. So rheumatoid factor is increased for rheumatoid arthritis. Inflammatory, whichever arthritis are there, in that the inflammatory mediators like the ESR, CRP, these all are raised. So we can understand that what category of arthritis it can be. Serum uric acid or the urinary uric acid excretion for diagnosing gout. Next. Okay, so why do you need to see? Most of the people feel that when you're using the joints, or you're moving about, or there is a lot of activity that you have done, then you try to experiment with the home remedies. So it is very important that why you should go to a doctor and when you should go to a doctor. These two things are very important. So why you should go? Because most of these, even if it is osteoarthritis and it is age related, and it's going to happen with everyone, if it is not treated in time or in the earlier stages, it might lead to deformity. Once deformities come into picture, then surgery becomes the option. But in earlier stages, we can do a lot of interventions, from physical therapy to exercises and other things, by which we can avoid the deformity also, reduce your pain also, and not go for something as severe, as complicated as a surgery. So timely diagnosis is very important, so that quality of life is also improved and the intervention that we are using is also minimal. There are nowadays a lot of rheumatologists who deal only with joint related. If not available in your city, orthopedics are the first person. They will diagnose and then decide whether you need particular treatment or exercise, or allied medicine, maybe physiotherapy or something like that. That is what they would decide after checking the degree of or arthritis that you have. So I would suggest that if it is a chronic situation, then always you will know that what grade it is. No doctor will ask you to go in for a surgery directly. They will ask you to go in for some physiotherapy sessions, some therapy, you go in for that. If not, then you should try only for 48 hours if it has newly started. So any newly starting pain in any of our joint, if there is an injury or no injury. Up to 48 hours, you can try your heat therapy or ice packs or some medicines at home, maybe the non-steroidal, which anti-inflammatory drugs which are there, so Brufen or something like that. Just 48 hours. If it's not settling in that much time, there is something more that needs to be taken care of. So you need to meet with a doctor. Next. Okay, so how can you reduce your risk to get arthritis, or for the ones who are young? What can you do, or even for the older ones who have not got arthritis yet? So exercise is very important. While we are saying that increased exercise or overuse causes, that is only a risk when you are increased weight, there is obesity, there is overweight. When that comes into picture, that is when uh, over walking or over activities is going to damage your weight bearing joints. But then main important point is that we have to be in the healthy BMI. So if your weight is healthy or in the normal range, there is not much load on the weight bearing joints, because of which you can avoid the arthritis or the damage to the weight bearing joints for a longer period of time. So maintaining a healthy weight is very important. For that, any low intensity exercise, not very high intensity where there are jerky movements or there is pressure on the joints, we go in for those type of exercises. Again, a lot of people feel muscle strengthening are not, or weight training and all of these are not recommended. But even if you have arthritis, it is important, because when we are talking about the joints, why there is arthritis or why there is that pain or inflammation, it is because the gap or the fluid in between the two joints has reduced, leading to friction between the two. That will happen when your muscles are weak. The stronger the muscles holding the two joints together, the better they can be held apart while you are doing your day-to-day activities or walking. So muscle strengthening exercises very important, even if you are having arthritis. There are some type of anti-inflammatory foods. So the people who are having inflammatory arthritis, for them, the ones with high antioxidants and fish, fruits, vegetables, these all can be included. They will not help with that, but they will help to keep it, reduce the, I would say, it from happening. Okay, weight management, like I mentioned, that the less the load on the joints, so the longer you can avoid the wear and tear from happening. Balance activity. So anyone with arthritis, you have to understand whether when you are having osteoarthritis or the age related one, which is developing after 55 or 60, you have to focus on having a healthy weight, having some type of exercise on a daily basis, and eating healthy. These all steps go side by side. Again, even stress or smoking, these are parameters which increase inflammation. Because of increasing inflammation, there are more risk of having or developing arthritis in the future. So you have to quit smoking also, and you have to see that stress is also managed by proper yoga or meditation and other techniques. Okay, next. So vitamin D and arthritis. So when we are talking about vitamin D, everyone is now thinking that it is going to help. We have to understand vitamin D is a fat soluble vitamin. Excess causes toxicity. So you must always know what are your values, or whether you are deficit or it is less. Definitely, we are, as Indian population, we are having a deficiency, but we should know how much, so that we can continue with the supplementation. Not blindly taking because it is deficit without knowing, because it will accumulate in the body and then cause ossification. So there is a risk of increased vitamin D also. But then how is it important for us? So for us, vitamin D is mineralizing with the calcium, with the phosphates, and forming a stronger bone. So stronger bone will help in maintaining the bone structures at their proper places and then avoiding the arthritis in future. So it is only helping not the joint directly, but by giving us stronger bones, it is helping us to avoid arthritis. So otherwise, we don't have any food sources. So normally we need the sun exposure, early morning or morning sun exposure. There are fortified foods Egg yolk is also having, fish is also having in limited amounts, has to be consumed on daily basis. So vitamin D levels require to be in the normal range so that we can avoid to a particular amount, that is by preventing or having healthy bones. Okay. Okay, so currently we have gout as the gouty arthritis as the most common one for most of the people. So gout is a type of arthritis normally affecting the big toe, small joints, or the knee. Okay, even shoulders later on get affected, but most common are these joints. Normally, it is diagnosed because of an acute attack. So suddenly you are having joint pains where there is redness, swelling, or warmth in those joints, which is unbearable. So that is why it's not going away for 7 to 10 days, because of which you reach out to a doctor to find out that why suddenly they have started paining. So what happens is, because of increase of particular substances or consuming particular things in our diet, it leads to increased uric acid, which then gets deposited in these joints. Okay. In the joints, because these crystals are present, there is inflammation and there is irritation of the joint space, because of which you have these symptoms. Most commonly, red meat, increased alcohol consumption. There is a lot of purine products, not all proteins, which you need to limit. So you don't need to stop it completely, but you need to limit the intake so that there is no deposition of these crystals in the joints. Okay. And otherwise, there are some medicines also, like diuretic, have that. For them also, there is an increased concentration of uric acid in the body. So it is necessary to meet a doctor. The doctor should know what medications you are on, so that we can guide because of which reason it has increased, and how we can stop the increase and control the acute attacks. So mostly treatment is by a proper diet, where the purines or alcohol consumption, the medications are titrated in a way that these episodes don't happen, or the uric acid levels are normal. And medications, if required, if till the dietary changes show their effect on the body. Okay.
Okay, Dr. Kritika, we are open for the questions. So if you have any query, please feel free to share with us. And Lavanya, can you just stop sharing the screen? Okay. Ma'am, there are a lot of questions in the chat section, which I will be taking. Just give me
Yeah.
one sec. I hope you all enjoyed the session. It was a short and very crisp session, I would say. I think very much to the point information, and we are also going to share the handout with you. तो आप लोगों को अगर कुछ भी प्रॉब्लम है या कुछ मिस हुआ है तो परेशान होने की जरूरत नहीं है. हम पूरी रिकॉर्डिंग एज वेल एज द हैंडआउट्स आपके साथ शेयर कर. There's a question by Razia ma'am that she's facing suddenly, like, right knee pain and calf muscles. So what should be the line of treatment for her? What should she do next?
See, if it is a sudden pain that has come up when you have started some type of exercise or overactivity, then we need to see that whether you're overdoing it, because not necessarily there should be a problem if it has come up suddenly. If it has been there for a very long time, then it can be because of some joint or osteoarthritis, depending on her age. So we'll have to see the age also, that what is your age. If you are above 50, 55, then it can be osteoarthritis. It can also be if you're overusing, so you've suddenly started a lot of walking. We need to check if vitamin D is okay. Then just by giving you vitamin D or calcium supplements, that pain will reduce. Calf pain, since you're saying, I feel that maybe you might have started increasing your walks or something like that. So the waste products are increasing in your calf muscle. Normally, the calf muscle has that accumulation, so you can try warm compresses or maybe a heat therapy to your calf muscles. You can lie down, keep your legs elevated, so that the waste products post walking are getting drained. You can try the home remedies. If they are not working out, then there are muscle relaxants, even as natural ones, which can help you to release that calf pain.
Great. I think that was a quite helpful answer, ma'am. So please, I hope Razia, ma'am, it's resolved now. You are aware that what you need to do next. We are also running with the steps challenge. Many people are writing down that we are facing the pain. So please make sure that you are not walking for 5,000, 6,000 steps if you are not used to do it at one go. Divide your steps throughout the day. These steps challenges are to make you active, to make you mobile, not to hurt you or injure you. So please be very, very careful when you are walking. Divide your steps throughout the day. And please make sure you are hydrated. The next question is by Mr. Dinkar that he developed the knee pain during strength training. Please cover
Okay.
that precaution, what precautions are required and what exercises he should avoid when he has a knee pain and what suggestions
Um,
you have for him.
since he has developed the knee pain during an exercise, specifically as strength training, I would suggest that if you're doing it by yourself, you might be doing it wrong. Okay, so because while strength training, there is a different type of pain. Muscles might pain, joints must not pain unless you're doing them wrong. So if you do not have, you take the help of some assistant or maybe a trainer so that you learn the right technique while you're doing this. A more common reason can be not doing your warm-ups or cool downs. So before doing any type of muscle strengthening weight training, it is mandatory that you do your warm up before that and you do a cool down after that, so that your muscles or your body is stretching, is ready for that intense session that you're doing, and it is healed also post the session. So this pain will not arise. So for now, I would suggest that you take a break since it has developed post exercise. Let it settle down. If it is not settling down even after you have stopped doing the exercise, then you will have to go in for an examination and check if there is some damage. If it has settled down, post that, always see that you're doing a warm up session, cool down, and you're doing it rightly. So these are some of the points that you can look forward for.
Absolutely. Ma'am, this next question by Mr. Prasad. So first part of the question is for me, so I think I will answer it. So you find difficulty in sitting on the floor. So I just suggested there is a yoga brick which comes on online. You can get it on Amazon or any of the Decathlon store. You can get that and you can sit on that particular brick. That's more convenient to sit and it won't harm you or cause you any discomfort. Second question is for doctor. Ma'am, he is
Yeah,
basically having a knee pain, and he would
correct.
like to know he's sedentary, he's a bank worker, and whether you suggest him to walk or run because he has a knee pain, and how he should diagnose what should be the better exercise for him.
Correct. So, according to what he has explained, and age, weight, and everything, it looks to be osteoarthritis only. In your case, I would not suggest that you do running. Okay, walking should be at according to your comfort that you're doing. Typically, do not sit on the floor cross-legged. If it is causing you issues, sit on a chair or the brick, like she has mentioned. You can use that for sitting. When you're looking for weight loss, focus on the diet part more than the exercise part. You can go for muscle strengthening, like I have mentioned earlier. But otherwise, you can go in for low intensity workout. You can go for swimming. So water therapy, very good for the people with arthritis, even osteoarthritis, because of the buoyancy of the water. There's no pressure on the weight bearing joints. So not necessary you need to swim, but you can do your walks in water, or there are a lot of water aerobics or water therapies that are nowadays available. You can go in for that as exercise as well. Okay, so see, for low intensity or other workouts when you're looking for weight loss, avoid the jumping or running or jogging type of exercises. But I feel that restriction or as per comfort, do not overdo at one time. Break it down and do your exercises.
So I hope you got your answer. Be very careful, and water aerobics, as Dr. Pratika said, it's one of the wonderful exercise which anyone can do, even if you are overweight or having any of the pain. So water actually works as a really cooling agent, and it reduces the inflammation also. Plus, it helps you in burning the fat, plus making your joints more mobile. So coming to the next question, there is another question that it happens that, finger of the joint, say they sometimes pain. And
Right.
particularly one finger pains a lot. So, which is quite uncomfortable. So, what is the reason for this and how one can work on it?
So, see, again, it comes to the underlying causes. Like somebody has mentioned in the messages, if it is osteoarthritis related, rest has to be taken. So, when it comes to the small joints of the hands, then rest is important. If it is gout related, once the medications are started, then automatically the pain in the small joints are relieved. So, then there is nothing else except the food restrictions that you need to follow. Arthritis type, there are obviously the orthopedic will check depending on the degree of deformity or the difficulty that you're facing. There are lots of things, maybe splinting that he will advise, or using of a brace or a cast for your hand when you're doing some activities, because restriction is going to be important for you when it comes to the hand. Overworking your hands, whether you're typing or doing small activities, have to be avoided. Proper rest will have to be taken time to time when you are doing your activities with the hand when it comes to osteoarthritis. Okay, and spondylitis, as she has mentioned. So, rest is your answer. Sometimes there are wrist or the thumb related. I think most common is the thumb. So, you must be having issues while doing writing or the fine movements. You can use a splint when you're doing those. So, it will reduce your pain.
Wonderful. So, I hope you people are making note of it. If not, then don't worry, we will give you the recording. But these are the very important pointers. From any three quick tips that you would like to give to all the audience, like when they have any joint pain, or there is, like, which generally people ignore. They apply some suppressant, and or they take medicines and they try to just avoid it. But they can really prevent injuries at very early stage if they meet the doctor at right time. So, what are
Correct.
your suggestions for them in that scenario?
So, like I mentioned, 2 days or 48 hours are the only times that you must experiment. If it's not giving you any relief, you must go to a doctor, because in that much time, anything temporary, whether it is an injury or over workout, should rest that particular pain. It's not resting, there is something that needs more attention than what you have already done. So you can try when it is the first 48 hours, you can try your heat therapies. So heating pads or warm compresses. You can try if it is inflammation, a warm joint swollen, you can try ice packs. You can also try over the counter medicines, very few little doses of ibuprofen you can be taking, again only for 2 days. And you can try the ointments or something like that. Pain is not going away, you need to meet a doctor.
Absolutely. Sam, there is always, like, link between diabetes and uric acid. People like often say is that, okay, I have uric acid, but my sugars are under control. But what should be the
Mhm.
control level of blood sugar readings after the meals, and how these two are interrelated to each other, the diabetes and the hyperuricemia? Please give some information on
So,
that.
normally it depends on the cause for diabetes. They are not directly linked, but again, people who are having diabetes mostly have a high protein diet. So, if you're not having proper guidance when your diet is being formed, um, you will just consume a lot of protein, not knowing how much per day you should be consuming. Then it will lead to gout or increased uric acid level. So, it's very important that somebody is telling you how much quantity you need to have so that we can avoid this from happening. Secondly, inflammation can be there because of the increased stress, which has led to diabetes. Then it can cause gout as well. But otherwise, the blood sugar levels directly will not cause any type of arthritis unless it is infective type, because the sugar levels are on higher side. So I would suggest that post meal, your readings should be inside 180. Fasting should be less than 120 is what we are looking for to have healthy joints also, good diabetes also. And you must focus that how much protein you're consuming is taken care of by your coach, so that you are not consuming too much leading to gout.
Ma'am, what is your thought on the acupuncture? Because nowadays many people suggest and they are moving towards the acupuncture. So there's Kaveri ma'am who is like very much interested in knowing that whether it is good or not.
So, see, it's not my expertise, so I would not like to comment on that. But then, see, acupuncture works differently. already the inflammation that is there, the nerves that are there. So we also have local therapy where we are giving interarticular steroids or other injections which are there, which give you so hyaluronic acid or something like that. Acupuncture works in the same way where it is burning out the nerves. So when they are, needling or something like that, which gives you the relief. Again, it is temporary. You need to keep doing that. So it's not, it just like the injections that you take in the joint, the relief is there till it lasts in between the joints and then it will come back again. It's not treatment. Yes, for relief, it is going to help you.
Perfect. I think it answers your question, Kaveri ma'am. So it's always good to diagnose, do the testing instead of just going. It's good to do natural therapies also, but a right diagnosis is very important to move ahead and take a call on any other alternative therapies. So there is another question by Bharat sir that I'm having shoulder joint pain, which is bearable but has been present for almost 5 to 6 months. This is not healing with general pain relief gel and sprays. What could be the reason and what should be his next step?
So, if you're having for such a long time, multiple reasons are there. Again, depends on the type of work you're doing. If you're not a person who is doing heavy workout with your arms or shoulders or no activity is there, can be because of frozen shoulder if you're diabetic. So again, diagnosis is very important. So you will need to go to an orthopedic if it is there for 6 months. If it is frozen shoulder, just by proper or initial physiotherapy with B12 and D supplementation, it will normalize. Okay. If it is something more because you're doing some activity, maybe weights, or maybe you use your upper body a lot, if there is some wear and tear, that will be possible to diagnose only by examination. So then after examination, he will decide that what is the reason and what type of treatment you need to be going. If it's injury, then surgery. If no injury and it is just a restriction or frozen shoulder, like I mentioned, which is very common, then supplementation with physiotherapy would be helpful for you.
I think amazing, Dr. Kritika, and we had a wonderful session. I think most of the queries are very, very repetitive. So I just want to highlight once again that if you have a pain in the joints or any sort of discomfort, don't extend it, don't be careless, don't avoid it. It's your body's call and the signal. So meet the doctor before it's too late and you need the surgery or something really severe which you are, scared of. So instead of just getting fearful, please go and meet the doctor and take relevant steps. Might be right now with some supplementations or the medications, doctor can correct it. So please take care of it. Secondly, I just want to make sure that one thing, please keep moving. I know we all have a sedentary lifestyle, but we don't use our joints, we don't exercise, we try to just compensate everything. But our body is meant for being mobile, being in motion. So every time, whenever you are going to a loo or using the going to fill your water bottle or going for a lunch, please take 2, 3 extra rounds, walk around, and then come back. This refreshes your mind, plus also helps your joints to move. So always stretch yourself when you are sitting on the chair. I will send some chair exercises. Many people have requested for that. Don't worry, I will send it on the premium group. You can utilize them. Lavanya, please make a note of it. And those who are finding problem in ensuring that what exercises need to be done, might be you can meet the trainer or the physiotherapist once. We also have done the physiotherapy session. All the recorded sessions are there on the YouTube. Please refer to them. We will share the link once again. Subscribe the channel so that you are aware of all the previous sessions which happened in the past. And they are all for you, right? We have done the physiotherapy week last month, and all these shoulder pain, knee pain, everything has been covered. And the physiotherapists have shown you the workouts also and the exercise chart. So please follow that. I think that would be much more helpful to you adding to this session. Thank you so much, Dr. Kritika. I think it was a wonderful session. We had many questions and you have resolved them all. It was a very
Yeah,
simple, very clear question to
I
understand.
give them a little bit takeaway message. So mainly in a short gist, what you have to understand is one, healthy weight is very important for you. See, we want to see that the quality of life is good. So you have to focus on healthy weight. Okay. Overweight is going to increase a lot of conditions for you, not just arthritis. A lot of diseases are linked with that. So one is healthy weight. Second is doing exercise. So never to not do exercise because there is some issue. There is always an way out. So there, for some reason, if the arthritis is very severe where you are not allowed to use them, upper body workout, or there are high intensity, like she mentioned, chair workouts, which you can burn that much energy as well. So you need to go in for that. Earlier stages where you are using, you must wear, so the older people which are there, you must wear a knee brace or knee support or things like that, but you must not stop doing your activity. Muscle strengthening, very underrated. You must do it regularly. Whatever your age is, the strength of your body is going to come with your muscles for every organ, every location of your body, whether it is joints, whether your internal organs, everything require the strength of your muscles. So you must focus on muscle strengthening. It has to be done rightly. So take help of a trainer or look at the videos multiple times, but focus on that part also. And when it comes lastly, alcohol intake, smoking, bad in every way. So you must focus on quitting that. And lastly would be a balanced diet. So your diet should have everything. Nothing needs to be cut off completely. Our coaches help very well with that. So you need to focus that every element is in your diet in the right proportion. Nothing needs to be eliminated fully. Right proper proportion and moderation of the item that you're eating is important. Okay.
Okay, completely gave the gist of the entire session and your tips. It was very insightful. I hope you all agree with me. So we will provide you the recording. You can refer to it again and again. I know it's very difficult to, retain all the knowledge. It's too much information in one session, but I think that's why we give you the recording so that you can refer to it. Lavanya, please post the PDF also for the handouts so that people can refer to it. Um, Thank you, ma'am. Thank you for the time. I know it's a Sunday morning and you have given us your time today. It means a lot. Thanks to all the warriors to join this session who have joined the session and made this session much more meaningful. Thanks a lot. Have a wonderful day ahead. Keep moving. Make sure that you are not ignoring your health. Make a point of everything that, what has been discussed and highlighted by Dr. Kritika. It's important to address the issues instead of making it more aggravated and worse. So thank you so much. Have a wonderful day ahead.
Yes. Thank you.